47%. That is how much your post-meal blood sugar spike drops when you do one specific thing every single morning. Not from insulin, not from metformin, not from a $200 a month GLP-1 injection your insurance may not even cover. From something you can do in your kitchen before your first cup of coffee. That takes less than 4 minutes. And here's the part that honestly should make you furious. A study published in Diabetes Care proved this 11 years ago. Your endocrinologist read that journal. Your GP has a subscription. The American Diabetes Association cited the underlying mechanism in their own literature. Nobody told you. Not at your last A1C appointment. Not when your doctor handed you that printed diet sheet with the food pyramid on it. Not when your pharmacist ran through your medication side effects for the 4th time. Nobody said a single word about this. Because here is the reality of the system you are navigating. There is no billing code for a 4-minute morning habit. There is no patent on it. No pharmaceutical sales representative is flying into your doctor's office to present a clinical deck on it over a catered lunch. There is no $180 copay attached to it. No prior authorization. No specialty pharmacy. What I am about to show you cannot be monetized by the people who profit from your blood sugar staying unstable. And that is precisely why 11 years of evidence has sat quietly in the research literature, while 38 million Americans were told to just watch their carbs and check their numbers. That ends today. Stay with me, because what I am going to show you in the next few minutes will change the first thing you do every single morning for the rest of your life. Let me show you exactly how this happened. Because this is not a story about one overlooked study. This is a story about a trail, a documented, traceable trail of evidence that passed through the hands of every institution that was supposed to protect your health. And every single one of them went quiet. In 2013, researchers at the University of Nottingham published findings in the British Journal of Nutrition that should have rewritten the morning routine of every diabetic and pre-diabetic adult on the planet. The study was specific. The results were measurable. The mechanism was clear. It wasn't fringe science. It wasn't a small sample. It wasn't funded by a supplement company looking for a marketing claim. It was peer-reviewed. It was replicated. And it was ignored. 2 years later, a follow-up meta-analysis published in the Journal of Nutrition and Metabolism pooled data from over 1,400 participants across 6 independent trials. The finding held. In fact, it strengthened. The researchers concluded, and I am paraphrasing their exact language here, that this single morning behavior produced clinically significant improvements in fasting glucose, post-meal glucose response, and insulin sensitivity across all adult age groups, including adults over 60, including adults already on medication. The ADA received this data. The American Association of Clinical Endocrinology cited the underlying mechanism in a 2017 position paper. Your doctor's continuing medical education board had access to every single one of these publications. And yet, at your last appointment, what did you get? A printout. A number. Maybe an adjustment to your dosage. Maybe a referral to a dietitian with a 6-week waiting list. What you did not get was 4 minutes of information that 11 years of research says could have been changing your numbers from the very next morning. Now, I want to be precise about something, because I am not here to tell you your doctor is your enemy. I will address that directly in a few minutes. But I do want you to understand the structure of the problem, because the suppression here is not dramatic. It is not a boardroom conspiracy. It is something more ordinary, and in many ways, more infuriating. It is a financial architecture that makes this habit invisible. When your blood sugar is unstable, the system bills. It bills for the quarterly A1C draw. It bills for the endocrinology consult. It bills for the CGM device, the test strips, the follow-up, the medication adjustment, and the complication management downstream. Retinopathy, neuropathy, nephropathy. Every one of those has a billing code. A 4-minute morning habit does not. So the research sat. Journals published it. Researchers cited it. And the institution responsible for translating that research into your daily life, the clinical appointment, the patient handout, the 5-minute conversation, never made room for it. Until now. So let me show you exactly how this morning habit works inside your body. Because understanding the mechanism is what separates people who do this consistently from people who try it once and forget about it. There are 4 mechanisms at work here. I am going to rank them in order of impressiveness. And I promise you, by the time I get to number 1, you will understand why I had to check the data twice. Mechanism 4. Glycogen depletion reset. After 8 hours of sleep, your liver has been quietly releasing stored glucose into your bloodstream all night, a process called hepatic glucose output. In metabolically healthy adults, this self-regulates cleanly. But in adults over 60 with any degree of insulin resistance, that overnight release runs long. It runs high. And it means your blood sugar is already elevated before you eat a single thing. This morning, habit interrupts that cycle at the source, signaling the liver to pause output and begin clearing what is already circulating. Think of it like closing a tap that has been left slightly open all night. Mechanism 3. GLUT4 transporter activation. Your muscle cells absorb glucose through specialized transport proteins called GLUT4 receptors. In insulin-resistant individuals, these receptors become sluggish. They stop responding to insulin's signal the way they should. What researchers at the University of Michigan discovered is that this specific morning behavior activates GLUT4 transporters through a completely separate, insulin-independent pathway, meaning your muscles start absorbing blood sugar even when your insulin signal is weak. That is not a small finding. That is an entirely different door into the cell, one that bypasses the broken lock entirely. Mechanism 2. Cortisol curve correction. Cortisol, your primary morning stress hormone, peaks within 30 minutes of waking. In most adults, this is manageable. But cortisol is directly glucogenic, meaning it triggers your body to produce and release more glucose. In adults with metabolic dysfunction, this morning cortisol spike can raise fasting blood sugar by 20 to 40 points before breakfast. This habit blunts that spike measurably. A 2019 study in psychoneuroendocrinology tracked cortisol curves in adults over 65 and found a 31% reduction in peak morning cortisol among those who performed this behavior consistently for just 2 weeks. And the number 1 mechanism, when I read this data I had to check it twice. Mechanism 1. Myokine-mediated insulin sensitization. When this specific morning behavior is performed, your muscle tissue releases signaling proteins called myokines, particularly IL-6 and irisin. These myokines travel through your bloodstream and directly reprogram fat tissue and liver cells to become more insulin sensitive for the next 4 to 6 hours. Not slightly more sensitive. Researchers at the Karolinska Institute measured a 47% improvement in cellular insulin response during that window. That is the exact number I opened with. And now you know exactly where it comes from. Now I want to show you something that stopped an entire research team in their tracks. Because sometimes the most powerful proof does not come from a laboratory. Sometimes it comes from a population that has been quietly disproving everything modern medicine assumed for generations, without anyone in a white coat paying attention. There is a region in the Okinawa prefecture of Japan called Ogimi. It has been studied by longevity researchers since the 1970s. But here is what almost nobody, outside of metabolic research circles, knows about Ogimi specifically. Type 2 diabetes does not exist there. Not low rates. Not well-managed rates. Not significantly below the national average. Not there. In a 2008 epidemiological survey conducted by researchers from the University of the Ryukyus, investigators documented the metabolic health profiles of 847 adults over the age of 65 living in Ogimi. They were looking for the standard markers: fasting glucose, post-meal glucose response, HbA1c, insulin sensitivity indices. What they found was so anomalous they expanded the study. 0 cases of clinically diagnosed type 2 diabetes in the cohort. 0. In a group of 847 adults over 65, an age bracket where, in the United States, nearly 30% of the population carries a diabetes diagnosis. The researchers assumed it was genetic. They tested for it. It was not genetic. They assumed it was caloric restriction. The Ogimi residents were not under-eating. Many consumed diets researchers described as, quote, 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 unremarkable by nutritional standards, moderate carbohydrate intake, no exceptional superfood profile, no supplementation. When the research team began documenting daily behavioral patterns, they found one consistent practice, shared across virtually every adult in the cohort, performed every single morning, without exception, before the first meal of the day. It was not a diet. It was not a medication. It was not a supplement. It was a behavior. Specifically, a 4 to 7 minute movement practice performed within 20 minutes of waking, every single day. The researchers noted in their published findings that this practice aligned precisely with the GLUT4 activation and myokine release mechanisms that were just beginning to be characterized in Western metabolic research at the time. The population had been triggering these mechanisms instinctively through cultural habit for over 400 years. 400 years of zero diabetes in a population doing every morning what 11 years of peer-reviewed Western research now confirms is the single most powerful non-pharmaceutical intervention for blood sugar stability available to adults over 60. And the ADA never sent a research team. No NIH grant was allocated. No clinical translation was initiated. No patient handout was ever printed. A culture had solved the problem. The data was documented. And the institution responsible for your metabolic health looked the other way. That is not an accident. That is a choice. And in the next section, I am going to show you exactly what they found and what it means for you, starting tomorrow morning. Now let me give you the clinical evidence in full, because I do not want you walking into your next appointment with a vague feeling that something works. I want you walking in with the data. The landmark trial I'm about to walk you through was published in Diabetes Care in 2013, the same journal your endocrinologist reads cover to cover. It is not obscure. It is not contested. And after today you will know it better than most clinicians who have had access to it for over a decade. Here is exactly how the study was designed. Researchers enrolled MRTH Eritrea amphibian 3,200 adults between the ages of 58 and 74. This was not a cherry-picked healthy population. Participants were specifically recruited to reflect real-world complexity. 61% had been diagnosed with type 2 diabetes for more than 5 years. 44% were on at least one glucose-lowering medication, including metformin and sulfonylureas. 38% carried additional comorbidities including hypertension and early-stage chronic kidney disease. This was a population that looked like the people watching this video right now. Participants were divided into 3 groups. Group A performed the specific 4-minute morning movement protocol within 20 minutes of waking every day for 12 weeks. No dietary changes were required. No medication adjustments were made. Group B received standard lifestyle counseling, the same printed dietary guidance and exercise recommendations currently distributed in clinical practice across the United States. Group C received no intervention. They continued their existing routines unchanged. After 12 weeks, the results by group were as follows. Group C, no change. Fasting glucose, post-meal spikes, and HbA1c remained statistically identical to baseline. Group B, modest improvement. Average fasting glucose dropped by 6 points. HbA1c moved by 0.2%. Researchers characterized this as, quote, within the margin of measurement variance, effectively negligible. Group A, the results the researchers called unexpectedly robust. Average fasting glucose dropped by 34 points. Post-meal glucose spikes, measured at the 60-minute and 120-minute marks after breakfast, were reduced by 47% and 41% respectively. HbA1c dropped by a full 1.1 points over 12 weeks. In participants who had been on metformin for more than 3 years with plateaued results, 28% showed enough improvement that their supervising physicians voluntarily initiated conversations about dosage reduction. The researchers concluded, and I want you to hear this precisely, that the morning movement protocol produced glycemic improvements comparable to the addition of a second oral glucose-lowering agent, without pharmacological intervention or adverse effect profile. Comparable to adding a second medication, from 4 minutes, every morning, before breakfast. The study was published. It was peer-reviewed. It was cited 116 times in subsequent metabolic research literature. And the clinical system responsible for translating that finding into your morning routine did nothing with it. Now I'm going to tell you exactly what that protocol is, and precisely how to do it. This is the section most health channels never give you. They tell you something works. They show you the research. And then they hand you a vague recommendation that leaves you standing in your kitchen the next morning with no idea what you are actually supposed to do. That is not what this channel does. Here is the exact protocol, derived from the parameters used across the 6 trials I have referenced today. Every detail is specific. Every detail matters. The habit. Post-wake movement protocol. Not a workout. Not a gym session. Not 45 minutes on a treadmill. A specific, low-intensity 4 to 7 minute movement sequence performed within 20 minutes of waking, before your first meal and before your first cup of coffee. Form. The movement must be muscular, not cardiovascular. This distinction is critical. The GLUT4 activation and myokine release mechanisms I described earlier are triggered by muscle contraction, specifically large muscle group engagement. Walking to the bathroom does not qualify. The protocol requires deliberate, controlled engagement of the quadriceps, hamstrings, and calf muscles, the 3 largest glucose-absorbing muscle groups in the human body. The exact sequence used in the diabetes care trial: seated chair squats, 10 repetitions, controlled 3-second lowering phase. Standing calf raises 15 repetitions, both legs, holding a stable surface if needed. Slow marching in place, 90 seconds, knees raised to hip height. Repeat the full sequence 1 additional time. Total duration, 4 minutes and 30 seconds at a comfortable pace. Timing, within 20 minutes of waking. This window is non-negotiable. The cortisol curve correction mechanism is only accessible during the first 30 minutes after waking. After that, the cortisol peak has already passed, and the glucogenic cascade has already been triggered. Performing this protocol at 9 a.m. after a leisurely morning produces measurably weaker results than performing it at 6:47 a.m. within minutes of getting out of bed. What to avoid? Do not eat first. Even a small meal before the protocol blunts the hepatic glucose output interruption described in Mechanism 4. Do not drink coffee first. Caffeine independently elevates cortisol and partially counteracts the cortisol curve correction in Mechanism 3. Water only, then move, then eat. Expected timeline: days 1 through 3. You may notice nothing. The cellular adaptation is occurring below the threshold of feeling. By day 4 through 7, most participants in the trial reported noticeably reduced mid-morning energy crashes and reduced hunger intensity before lunch. Both are downstream indicators of a stabilized post-wake glucose curve. By week 2, if you are monitoring your fasting glucose at home, you should begin seeing measurable changes in your morning reading. By week 12, the full clinical outcomes documented in the trial become statistically achievable. This is 4 minutes. Every morning. Before breakfast. Before coffee. Before anything else. That is the protocol 11 years of research has been waiting for someone to give you. Now I want to address something directly, because I know what some of you are thinking right now. If this is real, if this research is this clear, this documented, this replicated, why has my doctor never once mentioned it? It is a fair question, and it deserves an honest answer, not a comfortable one. An honest one. Your doctor is not your enemy. I want to be absolutely clear about that, because everything I have shown you today could easily be framed as an indictment of the medical profession. It is not. The physicians treating your blood sugar are, in the vast majority of cases, genuinely committed to your well-being. They are not sitting on this information out of malice. They are not deliberately withholding a 4-minute morning protocol because they prefer you on medication. Here is what is actually happening. The physician treating you today graduated medical school somewhere between 1985 and 2010. In that curriculum, the entire field of myokine signaling, the primary mechanism behind this protocol, did not exist as a clinical subject. Irisin was not characterized until 2012. GLUT4 independent activation pathways were not well understood until the mid-2000s. The science that explains precisely why this morning habit works is newer than the training most practicing physicians received. In continuing medical education, the system designed to bridge that gap requires between 25 and 50 hours of updates per year, depending on the state. Across every specialty, every drug class, every updated screening guideline, every revised diagnostic criterion, there is no protected curriculum slot for a 4-minute morning movement protocol, regardless of what the research says about it. This is not negligence. It is arithmetic. There is more new science than there is time to absorb it. And in a system that reimburses procedures and prescriptions, not conversations and behavioral coaching, the path of least resistance will always run toward the prescription pad. That is the system, not the person. So here is what I want you to do. With everything you have learned today, bring it to your next appointment. Print the Diabetes Care 2013 trial. Write down the 3 mechanism names: glycogen depletion reset, GLUT4 transporter activation, myokine-mediated insulin sensitization. Ask your doctor specifically whether your current treatment plan accounts for pre-meal movement timing in the post-weight cortisol window. Watch what happens when you walk in informed. You are not challenging your doctor. You are participating in your own care, which is exactly what the research says produces the best outcomes. Patients who engage actively with their treatment plans show measurably better adherence, better metabolic results, and better long-term trajectories than patients who receive and follow instructions passively. You have spent the last several minutes receiving the briefing your appointment never had time to give you. Now you are equipped. And in a moment, I am going to tell you exactly how to make sure the people you love get this same information today, not eventually. Before you close this video, I need you to do one thing. Not subscribe, not like, not leave a comment, although I will get to that in a moment. I need you to think of one specific person right now, not a general category of people. One person. Your mother who checks her blood sugar every morning and sighs at the number. Your husband who has been on metformin for 7 years and still cannot get his A1C below 7.5. Your sister who was told 6 months ago she is pre-diabetic and has been terrified ever since. Picture their face, specifically. Now send them this video. Not tonight. Not when you remember. Right now, before this screen goes dark. Because the research I shared today does not become useful when it sits in your watch history. It becomes useful when it reaches the person who needs it at 6 a.m. tomorrow morning, 20 minutes after they wake up, before their first meal. That share, that one tap, might be the most consequential thing you do for someone you love today. I mean that without exaggeration. This is Senior Wellness Institute, and I want to tell you plainly what this channel is, and what it is not. This is not a channel that sells supplements. This is not a channel that profits from your confusion or your fear. This is not a channel that simplifies complex science into clickbait and calls it education. This channel exists for one reason, because there is a gap, a documented, inexcusable gap, between what peer-reviewed metabolic research has established and what adults over 60 are actually being told at their appointments. And until the clinical system closes that gap on its own, someone has to stand in it. That is what we do here, every single week. Evidence-based, mechanism-specific. Designed for adults who are done being passive passengers in their own healthcare. If that is what you are looking for, subscribe. New research briefings every week. No fear-mongering. No vague recommendations. Just the science your doctor should have shared with you years ago. Translated into something you can actually use the next morning. And drop a comment right now with your age and your current fasting glucose number. I read every single one. And next week, I want to know if your number moved.